Hello guys, welcome to the Med Concepts with Bhavya, and today we are going to go through the second part of the radius bone anatomy series. In this part we are going to study about the features of the radius bone, and in the first part we have already seen the site determination of the radius bone. So without any delay, let's get into the video. So here we will be studying the features of the radius bone into three parts, that is the upper end, the shaft and the lower end. So we will be talking about each and every parts, and we would be observing each and every feature according to the parts in which we have divided the bone. That is, first we will go through the upper end, then we will go through the shaft, and then we will go through the lower end features. Now let us talk about the upper end. In the upper end you have the head and the neck. First, talking about the head, we already talked about it in the site determination, and that is the head is a disc shaped upper end. Okay, so the head is disc shaped and it is covered with hyaline cartilage. Then we talk about the superior surface of the head. If you have a bone and if you feel, there will be a depression. Okay, that means it is concave surface. Okay, so the superior surface, that is this surface, this is the head and the superior surface. So the superior surface is concave. Now the question arises, why? The superior surface is concave so as to articulate with the capitulum of the humerus bone. Now the next thing that you notice here is the circumference of the head. This circumference of the head articulates with the radial notch of the ulna. See, why do we say radial notch of ulna is because radial notch of ulna articulates with the radial head of the radius and thus forms the superior radio-ulnar joint. And the next thing that we would be noticing here is the neck. This is the neck of the radius. This neck is enclosed by annular ligament. So this is the neck and it is covered with annular ligament. And another thing that you may notice here is it has no capsular attachment. That is why the radio-ulnar joint is free to move and can cause easy pronation and supination movements. Next, we would be studying about the shaft. In the shaft, we will see three surfaces and three borders. So again, we would be talking about the shaft now, that is the shaft which is always present in the long bones, which you can see in the long bones, and it has three borders and three surfaces. Now noticing here we have three borders. First we will be talking about the borders, and we have three borders over here. The anterior border, as I have marked with a marker, the anterior border, the medial or interosseous border, and when you go back, the posterior border. Now talking about each one of them clearly, first comes the anterior border. The anterior border starts from the lower end of the radial tuberosity and is elongated or extended till the styloid process. This is the styloid process, right? So from the radial tuberosity to the styloid process. And here first it is obliquely going and then it travels down vertically. So first it is oblique, then it is vertically extended downwards. So the oblique part of the anterior border is known as the anterior oblique line. So this line, this part is known as the anterior oblique line, and this is your anterior border. Now talking about the posterior border, it is the same mirror image of the anterior border, and same thing we see here also, that is first it is posteriorly, it is oblique, and then it extends downwards in a vertical way. So first it is oblique and then vertical, and this is the posterior border. It is clearly defined only in the middle 1/3 in this area, only in the middle 1/3. And as we talked about in anterior border, this is known as the anterior oblique line. Similarly, this part of the posterior border is known as the posterior oblique line. So posterior oblique line, and this is the posterior border. Talking about the most important border of the radius, which is also very helpful in determining the side of the radius, is our medial border. See, if you can see here, it's very sharply defined. So the sharpest border of the radius is the medial border, and it is also known as intraosseous border. Why? Because you will have your ulna this side and they will be having intraosseous border. Ulna also has an intraosseous border which is known as the medial border, which is known as the lateral border, and this one, the medial border of the radius is the intraosseous border, whereas in ulna the lateral border is the intraosseous border, and in between, in the lower parts, you will have the intraosseous membrane which would be attaching the radius and ulna together so that they can move properly and smoothly to perform the pronation and supination. That is what it is. So this is the sharpest border of the radius, and which is also known as intraosseous border and is also called as the medial border, and it is present from the radial tuberosity till the ulnar notch. Okay, see, this is the ulnar notch. So from the radial tuberosity till the ulnar notch. Right now we have done three borders, that is the anterior border, the posterior border, and the sharpest and the medial border, right? The sharpest border, which is the medial border. Now let us talk about the surfaces. We have three surfaces, that is the anterior surface, the posterior surface, and the lateral surface. First, talking about the anterior surface. See, already written here, the anterior surface. Anterior surface is present between the anterior border and the medial border. Then we talk about the posterior surface, just going back to the posterior border, which is present between the posterior border and the medial border. See here, anterior, then lateral, then we have the posterior. So lateral surface is present between the anterior border and the posterior border. So we talked about three surfaces. Anterior surface between the anterior and middle border, that is the medial border. Then posterior surface between the posterior border and the medial border. And then the lateral surface between the anterior and the posterior border. So that is all about the surfaces of the radius. Now we are done with the upper end and the shaft features, and now we will be going for the lower end features. So the first thing that you will see here is the lower end is the widest part of the bone. See, if you see the upper end, it is round and disc-like, then the shaft is narrow, but this is the widest part, and now it has 5 surfaces. You can see very clearly here we have 5 surfaces: anterior surface, posterior surface, then this side we will have medial surface, lateral surface, and the last one is your inferior surface. So we have 5 surfaces over here: the anterior, the posterior, this one the posterior surface, the medial surface, the lateral surface, and the inferior surface. Now let us talk about the features of each of the surfaces. When you talk about the anterior surface is present as a thick prominent ridge. See, let me show you this part. It is present as thick prominent ridge. So the anterior surface is present as the thick prominent ridge where you can palpate the radial artery. The radial artery can be palpated here. Then we will talk about the posterior surface. Sometimes they may ask you what is the difference between anterior surface and posterior surface, and they will ask you how would you differentiate between those two. Posterior surface has 4 grooves, and another thing you can see here is it has a tubercle, which is the dorsal tubercle of Lister. This one, this marked one, the dorsal tubercle of Lister. That is what you see in the posterior surface. Now talking about the medial surface. See, this side is the medial. See, in the radius, the styloid process is at the lateral side. Whereas when we study the ulna, you will get to know that the styloid process of the ulna is in the medial side. So, this is the medial side in the radius. So, medial side, what does it shows is, it shows the ulnar notch for the ulna. So you would be seeing ulnar notch over here in the radius where the ulna would be articulating. Then talking about the lateral surface, This is the lateral surface. So the lateral surface is extended downwards as styloid process. This is the extended part of the radius, which is also known as styloid process. So in the lateral side you see the styloid process. Now let us see the inferior surface. In the inferior surface you have two areas. One is a triangular area and another one is a quadrangular area. So the triangular area present in the lateral side is for the articulation of the scaphoid bone, whereas the quadrangular area that is in the medial side is for the lunate bone. And this part, that is the inferior surface, is also involved in the formation of the wrist joint. So we talked about 5 surfaces. The anterior surface is smooth, present as a ridge, thick prominent ridge. Radial artery can be palpated here. Then the posterior surface shows you grooves for 4 extensors. And another thing that you see here is the tubercle for Lister, dorsal tubercle for Lister. Then when you go to the medial side, you see the ulnar notch where the ulna articulates, and in the lateral side, it is extended as the styloid process. And in the inferior, you have the quadrangular area for the lunate bone and the triangular area for the scaphoid bone. So hey guys, this is all about today's video. In today's video, we have studied about the features of the radius bone, and we have divided it into parts while studying, that is the upper end, the shaft, and your lower end. I hope it was clear, but if there is any query, please let me know in the comment section below. And also guys, the notes for the site determination and for the features are ready, and I would upload it today itself after uploading the video. And from now onwards, I would be uploading the notes part by part. Like if we are going through the site determination part, I will upload the site determination notes at that day itself. So it would be easy for you guys to refer it. Okay. So this was all about this video. I hope it was helpful. I hope it was clear. And again, reminding you, if there was any doubt, please comment down in the comment section below. And as always, do like, share and subscribe to this channel. Keep supporting, and please stay home, stay safe. See you in the next video.